Hello class, it's Dr. T with a tutorial to help you understand the distinction between program outcomes, course outcomes, and learner-centered objectives for each unit of instruction. You actually all did very well identifying the difference between program, course, and learner objectives. However, when it came to actually applying them to the response to your question, a number of you did get that a bit mixed up. So I want to go over and explain to you what it is to help you understand and ask that you carefully return to your questions so that you fix them if you didn't get them right. Why? Because this is probably one of the most key abilities, competencies as a nurse educator that you can have. If you don't understand this and if you can't actually apply it, it will lead to many confusing course outcomes. Your courses will not be strong and they won't be integrated. So let's take a little trip here and look at what this all means. I just kind of randomly chose a school. This is Pacific Lutheran University. And I'm looking at their baccalaureate nursing education. So here I've identified their Bachelor of Science nursing program outcomes. So you could put at the front of this, at the completion of this program, the graduate nurse student will, and then all these, demonstrate the ability to incorporate the dimensions of person, nursing, and environment to promote health. And all the way down, collaborate, pursue practice excellence, demonstrate lifelong learning, understand healthcare policy, and use of information systems. As you can see, program outcomes are exceptionally broad, and they're just kind of a big picture view of the overall competencies a new graduate nurse should have when they complete the program. So every nursing division identifies the program outcomes for their program, and it's usually a collaborative effort between the faculty as they identify what they believe to be the essential competencies, skills, and really abilities of each graduate student. So you have those as you begin, and you keep these program outcomes in mind as you develop your courses, because in fact every course outcome should be able to be traced back to be subsumed under a program outcome. Similarly, every unit learner-centered objective should be connected back to a course outcome. So let me show you how that works. Here is an example. Texas State. Again, I just kind of arbitrarily found this. This is a syllabus, and it's for medical surgical course, just like in your question. So we know we have a course description. You learned all about that in curriculum. The learning outcomes are identified. Now, these are the course outcomes for this medical surgical course. That means they are going to be the general outcomes for med-surg. They are not going to be specific to cardiac or respiratory or genitourinary or anything like that. They're going to be specific to medical surgical conditions. So note that, for example, this learning outcome, the students will explain the components of health illness continuum, identify prevalent medical surgical conditions affecting the adult, and utilize the nursing process to assist in developing a plan of care for selected med-surg conditions. So you see, every one of these is broad. They're all specific to medical surgical. They're talking about the generalities of it. So it's kind of the big picture thing. Apply critical thinking and problem solving to prioritize and organize care of clients with common healthcare needs. Okay, this is actually very good course outcome. She did a really good job of the course outcomes. So these are the learner outcomes for the course. They're course outcomes. Now, don't get too picky about, well, that one says outcomes, this one says objectives. You said, please identify course outcomes. She identified learner outcomes. You're going to find a diversity of labels that people place on these, but the concepts are the same. You have the big picture program outcomes. Then you have a course, excuse me, and then you have a course outcomes that are related to the entire course. So at the completion of the course, the student will identify these. Now, this is from, where did I say this was from? Texas State Technical College. And if you look down here in her course outcomes, she also identified provider of care, and then the student will, coordinator of care, the student will, and member of the profession, and solve problems. I would suspect, and I might try to find it, that their program outcomes identify these roles: provider of care, coordinator of care, and member of the profession. So this professor, when she identified her syllabus, she actually made the connection back to the program outcomes too, in her learner outcomes, which was kind of very in her course outcomes, which are very, very cool. So there's nothing wrong with doing that. It's very good to do that. So now let me show you down to the actual objectives for each class, and that's what you were doing. So if you look at what she did, she had her each week's identified with a clinical focus. So first week is reproductive system and disorders. And here we have the weekly learner objectives. And I'm not going to critique her levels of Bloom's, because you might want to do that as you look at this and see that maybe she needed to do a little bit higher levels, because she's got a lot of review, describe, and illustrate or identify. So those are kind of lower levels. But still, the point is well made. For each specific topic, she has learner objectives. That's what you were doing, identifying learner objectives for your particular topic. These learner objectives are specific to the topic. So she had reproductive the first 2 weeks. Let's look at something one of you did. So well, let's look at neuro. She's got one on neuro. So she's got the specifics to the neuro. She's doing bioterrorism, and she's got a whole focus on the objectives for the class. So these learner objectives identified for each class would be the expectations that at the completion of the class, the student achieves them. The class, meaning that unit of instruction. And then when you finish each of the classes or unit of instructions, the student would be expected to have achieved the course outcomes, right? So we're back up to the course outcomes. Let me go back there. Hope I'm not making you dizzy. All right, so here's the course outcomes. She's calling them learning outcomes. Then those course outcomes should connect back to the program outcomes. Pretty interesting, isn't it? So I'd like you to very carefully look at your response to this discussion question and revisit it and fix it so that you are confident that you understand how you actually apply. Because one thing you're learning in teaching strategies and in curriculum, it's one thing for the student to be able to define. Okay, so let's just look at this for a minute. You defined course outcomes, program outcomes, and learner objectives, and you did a good job at that. That's level 1 of Bloom's. That's memorization, that's repetition, that's repeating. And that's good. You need to know that. However, you want to get to a much higher level in application and analysis. So you have to look at those answers, analyze them, understand how you would actually enact them. In other words, how when you develop a course, you would actually identify course outcomes, how you would identify learner-centered unit outcomes, and how you would connect your course outcomes back to the nursing program outcomes. So I said in the beginning of this how critical this is. I want to close with a emphasis again on you must really get this in order to be successful as an educator. And not only that, I want you to be the kind of nurse educators who, when sitting in meetings with your fellow nurse educators, that you have deep clarity on the distinction between program outcomes, course outcomes, learner objectives for each unit, and the connection that they have one to the other. If you do that, you will be able to lead and guide others to be able to understand that. As you teach in other programs, you may have a syllabus that you look at and you say, this doesn't make sense. These aren't connected back to the program outcomes. The course outcomes are just identifying 2 levels of Bloom's taxonomy. All the other objectives are very low level. How can the students really develop critical thinking, clinical wisdom, and clinical judgment if all we're asking them to do is to achieve Bloom's levels 1, 2, or 3? So if we don't get them up to 5 and 6 in their learning activities and in how we evaluate them, then they're not going to be good critical thinkers, are they? So please revisit, please respond to this tutorial. Uh, so I know that you actually listened to it. So I'm asking you at the end of this tutorial to please respond. And your responding to it will let me know that you actually listened to it. Be blessed, class. I think you're doing good. I just want you to be the best nurse educators possible.